And it's now time for our weekly segment, Patel It Like It Is, where ABC News contributor Dr. Alok Patel shares health advice on the topics that matter most to you. Today, he's answering some of your questions. So let's start with Julia from Houston. Dr. Patel, Julia says, I saw your segment about organ donation. What are the requirements to be a donor versus a living donor? Dr. Patel?
Morning, Diane. I'm glad that Julia asked this question because as you and I discussed, there are 100,000 people on that list. Now, to be an organ donor after life, anyone can sign up above 18. At the time of death, doctors will decide if your organ is a good candidate. Living donors are people who are still alive. People have seen stories about this on the news and social media who may be able to donate one kidney or part of other tissues, such as your pancreas or lungs. Now, generally speaking, to be a living organ donor, there are some requirements. You have to be above the age of 18. Some hospitals actually require 21. You should be in good physical and mental health, and you have to be able to truly understand the risks, benefits, and what it really takes, and take that time off to make sure you get the procedure done. But also encourage for people to consider being an organ donor and also a bone marrow donor, which is slightly different, similar requirements. You can save a life in any of these cases.
Now, Alexis from New York City asks, what are the chances of a blood clot during labor?
You know, if we look at pregnancy, not just labor, but throughout all of pregnancy, Diane, this is an increased state where pregnant women are 4 to 5 times more likely to have a blood clot than women who are not pregnant because of some natural changes. But there are also some risk factors during pregnancy which may increase someone's chances of having a blood clot. Some of those risk factors do include some underlying medical conditions, the state of immobility, or the fact that you just can't be as active if you're pregnant, multiple gestations or having multiple babies, obesity, and also there are some conditions during labor as well, such as women who have a C-section are also at increased risk. Now, it's important for anyone out there to understand the signs of a blood clot, such as a swollen or painful limb or extremity, some changes in your skin color. Anything like that should be something you should immediately talk to a doctor about.
Is there anything you can do to prevent it?
I'm not sure if that sounded funny for me or you, Diane, but on the last question we talked about, the thing you asked about was about multiple sclerosis. Now, this is an autoimmune condition that can be extremely serious, disrupting the connection between the brain and the rest of the body. Now, scientists are still looking right now to figure out what could be signs of risk, but also what can be prevention. There are some risk factors that are being studied as well when it comes to multiple sclerosis. Some of these do include a family history of multiple sclerosis. It is 3 times more common in women. Certain infectious diseases and viruses can be as well as vitamin D deficiency. Smoking and obesity can also be signs. Now, it's important to understand that symptoms can differ from individual to individual, even type of MS, but anyone out there who notices symptoms such as muscle weakness, muscle numbness, tingling, changes in vision, anything like this should see a neurologist immediately, because if it's not MS, it could be something else that's extremely serious.
All right, that was in response to the question of can you prevent multiple sclerosis? Dr. Patel, your audio cut out in the beginning, but it chimed in just as you were hitting some of those important points. So thank you, Dr. Patel. Always great to have you.
Dan, I lost audio, but guess what? I'm assuming that you're talking about National Immunization Week, which is happening right now, and it's extremely important that we all talk about this. Now, this week, the theme is the big catch-up, because throughout the pandemic, those immunization rates for children have actually gone down. We want to not only get them back to 2019 levels, we want to keep them up, because there is a laundry list of childhood diseases we do not ever want to see again. Immunizations prevent that. They save lives. Keep it up. Check with your pediatricians, parents.
All right, Dr. Patel, thank you for that. And if you have questions for Dr. Patel, we do this every Friday. Leave him a message on our Instagram feed at ABC News Live. He just might answer your question right here on air.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.